Dr. Edward Simmer became the director of DHEC in February. And since that time, he's been tackling a lot of issues, including, of course, COVID. I talked one-on-one with Dr. Simmer for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Dr. Edward Simmer, welcome to Quintin's Close-Ups.
Thank you. It's great to be here.
Oh, I appreciate it greatly. Obviously, you are the newly elected director for the South Carolina Department of Health and Environmental Control, better known as DHEC. And I know that you were appointed to the position by the South Carolina Board of Health and Environmental Control earlier this year, I believe on February 4th. From February 4th to right now, Dr. Simmer, who are you in this particular role?
Did you say who am I in this particular role?
Yes, sir.
So, well, I think, I am obviously a public health physician, and in part, and clearly bring that to this position, but also we obviously are responsible for healthcare quality and environment. So I'm really someone who's here to advocate for the people of South Carolina, making sure that we are doing everything we can from a health and environmental standpoint to improve their quality of life, to improve their health. Because when you think about it, really most environmental protection is really helping people improve their health. If you're protecting them from unsafe air, unsafe water, if you're helping them not be flooded out during a hurricane, if you're protecting them from a factory that's putting unsafe things into the environment, really that's all designed to help preserve people's health and improve their quality of life. Much like with the public health side and the healthcare quality, when we're trying to make sure that, for example, nursing homes are up to standard and provide a safe place for people to live, or as we fight the COVID pandemic, and clearly trying to protect people's health and lives against this terrible virus. I think, I am here again to protect the people of South Carolina, to help them, take action that will allow them to improve their lives and make South Carolina a great place to live.
And speaking of COVID, as we sit here right now, Doctor, as of 9:30, where is South Carolina with COVID by the numbers?
So we are doing fairly well. Certainly compared to the very bad time during December and January, a number of cases is down significantly. We actually now have, the number of deaths is down very significantly. We've actually gone some days without deaths, which is great. Now, of course, we're not there until we don't have any. And, every death is one too many, and it's a very sad thing. But at least we're much better than we were. Those numbers continue to trend downward. At one point we had more than 1,000 people a day in the hospital for COVID. That number is now well under 200, and continuing to trend downward. We have very few people on ventilators in the hospital due to COVID, and that's a great change. So we've made a lot of progress, but there's still much more to do. And obviously, we've made some changes where, certainly if you're not vaccinated, we still recommend you follow all the precautions. Wear a mask, socially distance. But if you are fully vaccinated, meaning you've either had one of the 2-shot vaccines, had both shots and waited 2 weeks, or had the Janssen vaccine, the single-shot vaccine, and then waited 2 weeks, in most cases you can go without a mask safely, and and get back to most of your normal routine. So in those ways, we've made a lot of progress. I think where we still have a lot of work to do is getting more people vaccinated. The Delta variant is out there. We've had cases of Delta variant in South Carolina, so we know it's here. The Delta variant is much more easy to transmit, and if you do catch it, it tends to cause more severe illness. So we're very watchful of that. And our vaccination numbers for fully vaccinated are still under 50%. I'm cautiously hopeful we might get to 50% fully vaccinated by early July, maybe by July 4th. We have some things in place now that we're trying to do to bring vaccine to every person in South Carolina who wants to take it. It is certainly voluntary and should be, but we're really encouraging people to take the vaccine. We need to get our vaccination numbers up higher so we don't see another surge and we don't lose more people to this terrible disease.
And I'm going to get to the Delta variant and obviously the vaccinations in just a minute. But let me ask you this, Doc. What percentage of positive tests in South Carolina is sequencing?
So a relatively small number of tests get sequenced, roughly around 1%, because sequencing is very challenging. It's a lot of work, and it takes quite a bit of time. So we try to do a random sample of tests so we can track what's going on in terms of what sort of variants we're seeing across the state.
And would it be possible to report whether positive cases are vaccinated versus not vaccinated?
We do try to track that. We don't always have that information, but we do try to track that. I can tell you that the vast majority of cases we see are not vaccinated, not fully vaccinated. So that, there have been a few breakthrough cases. But nationwide, if you look at the data, the risk of dying from COVID after you've been fully vaccinated is lower than the risk of getting killed by lightning, which is a fairly rare event. It's very, very small, something in the neighborhood of 0.003%. So the vast majority of people who are still catching and unfortunately sometimes dying from COVID are those who've not been vaccinated.
And I have learned that South Carolina just removed restrictions on the hydrochlorine. Is that true?
Well, I mean, doctors can prescribe. Are you referring to the medicine?
Yes,
medication?
Sir. Right.
Yes, okay. So, doctors can prescribe medications once they're licensed by the FDA for whatever indications they feel is appropriate. Mm-hmm. So we've never had a law in South Carolina that said you may not prescribe for that. There's not any real evidence that particular medication is effective for COVID, and that's been studied. So we do not recommend it. But if a doctor chooses to provide that, there's no law that would prevent them from doing it.
And are there therapeutics being promoted?
Well, there are. Certainly, there are certain medications, monoclonal antibodies, for example, which have been shown to reduce the severity of disease. Generally, those are best for people who have moderate level disease but are not yet in the hospital. And that has been shown to be helpful. And we certainly are promoting that and have done a lot of work to make sure those are available to patients who need them.
And let me get back to the Delta variant, because you all said this on Twitter, quote, "We aren't done with COVID-19, and it isn't done with us. COVID-19 and its many variants, that is, continue to circulate in our communities and pose a significant risk to those who are not fully vaccinated. Everyone 12 plus should get vaccinated to protect themselves and others." Let me ask you this, Doctor. Will this pattern shift if we see outbreaks, given that many counties have very low vaccination rates and we have the Delta variant ready to rush in?
So certainly, we are very concerned about the Delta variant. We've had some cases of it in South Carolina, not very many, but some, and it doesn't take long for that to spread. So certainly, in those counties where vaccination rates are low, we are very concerned about that. We've not seen a surge yet, but we are watching very carefully. And there certainly is that risk that with the Delta variant out there, if it gets established in one of our communities with a low vaccination rate, that it could do serious damage.
Now, where exactly are we seeing the Delta variant in South Carolina? Where are those low counties, I should say?
Well, I think, we've only identified 4 cases of Delta variant in South Carolina spread around the state. But that's too small of a number to really say there's a trend in one location.
Okay.
Now, we know there's more cases out there, since obviously we don't sequence every single case of COVID. So we know there's more out there. I think our concern with the Delta variant, again, because it's easily transmissible, is it would spread easily. It could easily, it could easily cross a county line, a city line. COVID knows no boundaries, right? It doesn't care where the political boundaries are. It goes where it goes. So there is certainly that risk in those, especially in counties with lower vaccination rates, that we could have a spike of cases amongst unvaccinated people, especially with the Delta variant.
And where are those low vaccination rates in those counties?
Well, it tends to be in some of our more rural counties, generally. Some of the counties along the I-95 corridor, as it's sometimes called, we have some challenges in that area. Our larger urban counties, Charleston, Richland, those counties are doing somewhat better. They're still not where they need to be. We still need to get folks vaccinated in those areas too. But clearly, some of our rural counties, especially along the I-95 corridor, are where we have our biggest challenges. And to address that, we are working very hard to make sure that everyone who wants the vaccine can get it. It's a combination of access and hesitancy at this point. We just closed a contracting offer to deploy mobile units across the state, because we know we have a lot of people who don't have internet access, who rarely leave home, who may not have reliable transportation. So asking them to come to a vaccination center 10, 20, 30 miles from their home is just not realistic. So we are going to be awarding a contract here in the near future, a very near future, that will get mobile units out into neighborhoods, out into the rural areas, so that anyone who wants to get the vaccine can easily do so, and will overcome those transportation and other barriers that still exist.
And how long will it take for those contracts to be awarded?
So we're hoping to award those contracts early in July. And then it will take a little bit of time for the contractor to get up and running, but we anticipate that this will be going really full bore before the end of summer.
And I know since the Delta variant is quote a variant of concern to the CDC, is DHEC continuing to report the number of information down to the number of new cases, percent positive, and the number of hospitalized?
We are, yes. You can still find that on our website.
And is South Carolina still ranked 40th in vaccinations?
I haven't checked in the last day or two. We've been hovering around 40, so I believe we are still close to that, but I don't know the exact number today.
And I know you all said this quote, as of obviously June 21st, 2021, we are at 41% of the eligible population completely vaccinated. We would like that number to be high, as you just mentioned. Let me ask you this, Doc. Are there too many adverse reactions being reported?
I don't think there's too many adverse reactions being reported. Obviously, if someone has an adverse reaction, we want them to report that. We need to know that. But if you look at the data, both within South Carolina and certainly nationwide, this is a very, very safe vaccine. Well over 100 million people have been vaccinated nationwide, and that's a good thing. The number of individuals who've had a serious adverse effect or who've had, or even worse, have died from something associated with the vaccine is very, very small. Compared to almost any other medical treatment, this is a very, very safe procedure, getting the vaccine. Most people have mild side effects, some arm soreness, perhaps a little bit of fatigue the day after, especially after the second dose. But those things resolve within a day or two. And even some of the things that have been covered lately, for example, there have been rare cases of inflammation of the heart in some children who've received the vaccine. That sounds very serious, and it can be. But it turns out that almost all those cases have been mild. Those children have recovered fully, fairly quickly. And compared to what you can have, when you look at the risk of having COVID and the risk of death from COVID, the risk of getting the disease is much, much worse than the risk of getting the vaccine.
You said this quote on the Twitter website, following the CDC's announcement that the COVID-19 Delta variant has been classified as a variant of concern, VOC, DHEC is doubling down on its call for all eligible people to get vaccinated. This is especially important for young adults who are part of the most unvaccinated age group nationwide and here in South Carolina. What stats are you showing South Carolinians on how this is actually impacting people?
So, it is certainly true that, younger people, when they get COVID, tend to get less severe cases. Most of the deaths from COVID have been in folks over the age of 65. But younger people have died from COVID, to be sure, even folks who don't seem to have a lot of, risk factors. So it can happen. And certainly, if you're younger and you catch COVID, two very bad things can happen. One is it can take you out of action for a while. You have to quarantine. If you're working or if you're on a sports team, let's say, you just left your team behind. Your team can't rely on you now for 2 or 3 weeks because you're not available. If you're working, now you're out of work for 2 or 3 weeks. And a lot of our folks can't afford that. So that can be a really major event. The other serious concern among young people catching COVID is that they can spread it to others. Perhaps others who are more susceptible or more at risk. If they give it to a grandparent or an elderly neighbor, who for whatever reason is not vaccinated, that person can have a very bad outcome. So that's why we're so worried about younger folks, which is our lowest group for vaccination rates right now. We're actually about parents seem to be getting some of their children now that children 12 and up can get vaccinated. We've seen a fair response amongst the 12 to 17-year-old group, I think because parents are bringing them in. But our age group of about 18 to 26 is particularly low. And so that's an area we're really trying to target. We've got some new messaging and some new campaigns that we're starting up here in the next 1 to 2 weeks to try to encourage those folks to get vaccinated, especially before they go back to school.
Now, what's being reported as far as the number of new cases / deaths / hospitalizations that are vaccinated and unvaccinated?
So again, the number of cases in people who've been fully vaccinated is very low. It's literally, I think nationwide, and this data is a little bit old now, but nationwide, I think about 500 people who've been fully vaccinated subsequently died from COVID. So that's a very small number when you look at the total number of people who died from COVID. Now, again, every one of those deaths is a tragedy, but it is clear that being vaccinated, it protects you to a very great degree against either serious illness or death. Amongst those who are not vaccinated, the rates are much higher. We continue to see, over 100 cases a day here in South Carolina, almost all amongst those who are not vaccinated. We still are having deaths. The death rate is much lower, and that's great news. But every week we still have several deaths from COVID in South Carolina, and even one is too many.
Is there a need, Doc, for a booster?
We don't know yet. That's a great question. We think it's probable that there will need to be a booster, that the immunity will not stay forever. Looking at other vaccines that work against viruses, oftentimes boosters are required. So we anticipate that the booster will be required, but the data has not borne that out yet. So at this moment, we are not recommending boosters, but we're certainly planning for the potential that we may have to in the future. And I can tell you one of the things that we're really looking at very strongly is offering the booster for the COVID with, for example, the flu vaccine or another vaccine to make it easy for people to do it. You go in, you get your flu vaccine like you normally would, and you get the COVID with that. We think that'll make it much easier for folks to do that and hopefully improve the rate of people getting the booster if it becomes necessary to do that.
Have you all looked at the VA-ERS recently?
We do look at the VA-ERS. I would emphasize, though, that that's the vaccine adverse event reporting system where people can report things that happened after they got the vaccine that they think may be associated with the vaccine. And I know there's been a lot of discussion about that. I would note, and the folks who run it, the CDC, will also tell you this, that information is not verified, as in that no one knows for sure if what's being reported there was actually due to the vaccine or unrelated. It's certainly possible for someone to get the vaccine, and then just by random chance have a fatal heart attack the next day, or hey, they died the day after they got the vaccine. That looks like a connection, even though there really wasn't any relationship at all. So you have to be a little bit careful about the VA-ERS because we don't know what caused those side effects that are being reported. It might be the vaccine, but it might be something else. Now, having said that, we do look at that. Certainly, the federal government tracks that information as well. And that's how we have found some of the things that have been concerning, like the myocarditis, that have been seen with the vaccine, and those warnings have then been given.
Yeah, I know you have to run, but let me ask you two quick last questions. Let me talk to you about the Jabal Sutherland case. In January, there was allegedly a violent incident at the Palmetto Low Country Behavioral Health, an incident that led to the arrest and ultimate death of Jabal Sutherland in police custody. I know that DHEC did not know about it, but for 4.5 months. What have you learned since it was brought to your attention?
Well, obviously, once it was brought to our attention, and we appreciate the folks who did that, who told us about it. And we would encourage anyone who knows about a situation like that, report that to us. Don't assume that we know. Make sure you call us and tell us. Every facility like Palmetto Behavioral Health is required to report to us when they have a significant bad event, like what happened to, the tragedy that happened to Mr. Sutherland. And they did not do that. They did not report to us. They are required to do that, and we've investigated. We've taken action based on that, and there's now a corrective action plan in place to make sure that does not happen in the future. I will also tell you that investigation into that situation continues. So, I don't want to say anything more about an open investigation, but that has not been finalized. We did take action on the one clear violation we found with regards to reporting, but we are still looking at other aspects of that case, and it's possible. Let me emphasize that we don't know for sure if any other action will be taken, and I don't really want to comment further than that because it is an open investigation.
Let me ask you quickly, though, when did they actually report this incident to you all?
Well, actually, we learned about it, we called them, and at that point they did file a report, but they did not file the report until after we called and asked them about it, which is obviously much too late.
And one last question, Doctor. I know you have to run. I want to ask you this, and I thought I had it. But do you all want to do some sort of pop-up satellite, vaccination sites around the state?
Yes, and that's what I was mentioning. We're going to be putting mobile units out there. Now, we have over 900 sites already statewide that offer the vaccine, including hospitals, pharmacies, individual medical providers, clinics, in various communities. And so we have a lot of private partners who are doing a great job helping us get the vaccine out, and we would not be where we are today without their amazing help. Now, having said that, we need to do more. So as I said, we're going to be getting these mobile units out into communities. They'll be driving all around the state, Hopefully we can get them into just about every community, rural, urban, doesn't matter. We want everyone to have easy access to the vaccine. Most of the places now, if you want a vaccine, you can just walk in. You don't need an appointment. So yes, we have lots of locations statewide where you can get the vaccine, and we're going to be adding even more with these mobile units.
Dr. Edward Simmer, thank you so much for your time. And again, welcome to Quintin's Close-Ups.
Thank you very much for your time. I appreciate it.
You're welcome anytime.